Ndi Anambra, Ekenemonu. Once again, it has become necessary to address you on the second wave of COVID-19 pandemic that is currently sweeping across the world. Ndi Anambra, this threat is not only real, but even more deadly. I repeat, this threat is not only real, but even more deadly. It is more deadly because after struggling with the pandemic for 9 months, we have dropped our level of vigilance and returned to our normal lives. But the virus has not gone away. On the contrary, it has come back with renewed viciousness, and it is claiming many lives because our people are not complying with COVID-19 protocols. Let me remind you how we responded to the first phase of COVID-19. In Ndi Anambra, our index case of COVID-19 was reported on April the 9th, 2020. We were fully prepared to deal with that emergency. We had erected some of the best protective care centers in Nigeria, and our healthcare workers were sufficiently prepared to handle this challenge. We managed the pandemic so well that in November last year, Anambra was rated as one of the states with the lowest number of positive results in Nigeria. As of December 7, 2020, we had conducted 90,000 tests and only 287 were confirmed positive. As at the dates too, Anambra had no new cases of COVID-19. We had no patient in our protective care centers and none on home treatment. Anambra was beginning to breathe freely again. We are all enjoying the fruits of our collective efforts, the leaders of the church, the traditional rulers, market leaders, schools administrators, and the general public. And we have made great efforts to obey the COVID-19 protocols then. We are doing just fine until the second wave of the pandemic crept in. Ndi Anambra, this second wave of COVID-19 did not take us by surprise. We have been monitoring global trends on the pandemic, and we saw it coming. We anticipated that the second wave would hit us hard because of our well-known culture of mass return during Christmas and New Year seasons. So we made efforts to prepare our people to mitigate the impending challenge. We held wild consultations and town hall meetings with the Igwes, the religious leaders, civil society organizations, leaders of market task force, transport operators, leaders of various community groups and associations. During these meetings, we emphasized the need to revive all structures that helped us survive the first few waves of the pandemic. Sadly though, it appears that our warnings fell on deaf ears. Our people allowed themselves to be carried away by the joys of the Yuletide season and failed to maintain COVID-19 protocols. Today, we are faced with a clear and present danger. Between December 7, 2020 and January 11, 2021, we have recorded 110 new cases of COVID-19 in Anambra State. This is not good at all. In the Anambra, we must do everything within our power to halt the spread. That is why we have revved up our testing capacity and brought the total number of tests done so far to 13,412 tests so far, surviving the resurgence. In the Anambra, my administration has taken a string of hard decisions to stamp out the renewed spread of this pandemic before it gains a serious advantage over us. Number one, all government offices must observe the standard COVID-19 protocols, wash the hands at the entrance, wear face masks properly, regular use of hand sanitizers, and strict observance to social distancing. Nobody will be allowed into any government premises or property without properly wearing a face mask. No one will step outside their homes without properly wearing a face mask. Number 3, the ban on nightclubs is still firmly in place. Hotels are directed to ensure strict compliance to COVID-19 protocols, or we shut them down. There should not be more than 50 people in any public gathering. Number 5, COVID-19 action team in all our 61 markets must ensure full compliance to the standard of COVID-19 protocols. They must set up a standard washing point at the entrance of each market, take a temperature of visitors to the market, ensure that both the traders and their customers are properly wearing their face mask. All markets in Anambra State are given only 1 week to set up the necessary safety standards and ensure proper compliance. Any market found violating the standards after 1 week shall be quickly closed down permanently. Number 6, transport operators are advised to revert to all the practices that helped us during the first wave of the pandemic. They must ensure social distancing inside the vehicles and maintain a passenger manifest. Number 7, schools are advised to review the COVID-19 structure and practices that helped us protect our children during the first wave of the pandemic. Schools in Anambra State shall not open on January 18, 2021, as earlier scheduled. Rather, the schools will reopen after 2 weeks from that date to enable the principals and teachers prepare for the return of our children. We commend our schools, proprietors, and administrators in the state for their careful handling of the first wave of the pandemic. However, we expect even more from them this time. Number 8, churches and other religious organizations are advised to set up an action team and go back to the practices that helped us in the first phase of the pandemic. We shall align with the policy on the possible nationwide curfew by the federal government to ensure effective compliance. Number 10, our test centers are active and ready to handle cases with impressive turnaround time. We hold the record of the shortest turnaround time in the country today. We have cascaded our sample collection to all the 21 local government areas in the state. For the sake of emphasis, nobody, I repeat, nobody should go to any market, public places, churches, schools, or enter any transport, attend to any functions as stated above without properly wearing their face masks. Finally, the investment we made in the setting up of oxygen production plant in Chukwuemeka Odumegwu Teaching Hospital, Amako, in 2018 has started to pay off. When we made this investment, we had no idea that sooner than later, oxygen will become such a priceless commodity. Today, I'm delighted to let you know that this facility, oxygen production plant that we have in, that we cited at Amako Teaching Hospital, can produce 600 1.5 cubic meter cylinder per day, 600 per day. And what we intend to do with that 600 per day is that we're going to give 450 free throughout this COVID period to all the primary health centers in Anambra State, then 150 free to the teaching hospital at Amako. The rest of the production as we are making them will go to the general hospitals and of course the private hospitals. And in all these instances is going to be free. That is the contribution of the government of Anambra State to fighting this pandemic. In the Anambra, we have been here before. We shall overcome it a second time. But we must work together first, like we did the first time. Everyone must play their own part well for us to survive. As a government, our key strategy is testing and treating and tracing COVID-19 cases in line with the guidelines given by the World Health Organization and Nigerian Disease Control Center. In the Anambra, we are firmly on top of this situation. Please don't be afraid. We shall handle this resurgence the way we handled the first wave. We have managed so many cases successfully, and we shall do more. Our protective care centers are ever ready to deliver greater results. Our COVID-19 home management task force has managed more than 95% of the cases successfully in their various homes. We shall continue to do our best to save lives and preserve our people until we take delivery of the COVID-19 vaccine. In Anambra, I will not end this broadcast without some kind words to our healthcare workers who have continued to sacrifice their lives and their personal convenience for our collective safety. They deserve our prayers and commendation as they buckle up to stem the rise of pandemic this second time around. Let's increase our chances of surviving this scourge by obeying the safety standard. It has been proven that the only way to win this fight is that you do a test. If you do a test and you are positive, the chances of your survival is almost 99%. But if you allowed yourself to be sick before you do a test, then it increases the chances of one losing the life. Let me emphasize, do a test now. If you're positive, we can treat you with ease, and your chances of surviving will be over 99%. If you don't do a test and you are sick, and at that time it is discovered that it's COVID, it's almost very difficult at that point to revive you. Thank you very much. God bless Anambra State. God bless the Federal Republic of Nigeria. Thank you.